Hey everybody, Dr. Alan Goldhamer is the director of the TrueNorth Health Center, one of my favorite places because they're responsible for transforming the lives of thousands of people over the years, over the decades, all through diet and lifestyle change. It's incredible how effective it can be, and because of his track record, the way he feels, his philosophy on diet and lifestyle means a ton to me. He's helped me, he's helped so many of you to change your lives, and I want to talk to him today about this whole oil debate that's going around, and hopefully we'll dive into some other topics too. Without further ado, let's talk to you, Dr. Alan Goldhamer. Thank you so much for being here. I had a few interesting questions based on what we're all seeing going on with some changes to the dietary recommendations, but I thought we'd start with a little background, and that is, what is the diet we humans should be eating and why?
In our experience, the diet that seems to work the best for people is a whole plant food diet that's free of the chemicals that are added to food that make people fat, sick, and miserable. And those chemicals include salt, oil, and sugar. From our perspective, salt, oil, and sugar are not food. They're hyperconcentrated food byproducts. They're added back to food to make food taste better. And tasting better essentially means results in more dopamine stimulation in the brain. Dopamine is the neurochemical associated with pleasure. So the more dopamine your brain squirts out, the more you like whatever it is you put in your mouth. And it turns out that salt, oil, and sugar are hyper-concentrated food byproducts that artificially stimulate dopamine production in the brain. And that is the reason, that dietary pleasure trap, why 75% of people were overweight or obese, and why we've got an entire society dying prematurely because we're fooling our satiety mechanisms with the chemicals we're adding to our feed.
I want to get into oil for sure because that's been a big topic lately these last few weeks. But before we do that, I get a lot of pushback about salt, for example. We need salt in the diet. It's got to be there. We're athletes. We're sweating all the time. How do we respond to those kinds of comments?
Well, they're absolutely right. Sodium is an essential nutrient without which we die. But just like you don't need to add sugar to your food to get enough carbohydrates, and you don't need to add oil to your food to get enough essential fatty acids, you don't need to add salt to your diet in order to get enough salt. In fact, the American Cardiology Association says you need about 500 milligrams of sodium a day. You get all the salt you need by eating a variety of exclusively whole plant foods. You don't have to add salt. Now, it's true, athletes are going to need a little more sodium because they burn more calories, just like pregnant women need a little bit more sodium because they burn a little more calories, but they don't need a higher proportion of salt. They're going to still get the salt from their whole natural foods diet. And if somebody was concerned about increasing sodium concentration for some reason, they could do it by focusing on more of the foods that are naturally very high in sodium, your chard, your tomatoes. There's lots of foods that are particularly rich in sodium. Certainly nothing that would require you to go out and be adding salt to your diet. There may be some exceptions. Somebody that has hypoparathyroidism doesn't make mineralocorticoids or some other, usually people that are on medications that deplete their ability to recycle sodium effectively. There might be issues that can come up but for the general person, certainly the athlete, the pregnant woman, adding salt to the food, just like adding sugar to the food or adding oil to the food is the beginning of the problems that begin to arise.
Excellent. Another thing we see a lot is these meds for cholesterol, blood pressure. Like, it feels like everybody's on them and everybody's okay with being on them. How do we get tricked into this?
Yeah, well, the fact is that number one, you have to look critically at the effectiveness of the drugs, and you find they're not nearly as promising as they lead themselves on to be in terms of preventing disease. But more importantly, the reason why lipid levels are elevated to begin with is because of the greasy, fatty, slimy, dead, decaying flesh processed food diet that people are eating. And what's really a shame from my perspective is now even some of the people that are a little bit more moderate in lifestyle medicine and whatnot are trying to be more flexible by incorporating a little of this, a little of that in the diet in order to make the diet more palatable or more interesting to people. And I understand why that happens. It's because many of these doctors are loving, caring, kind individuals who are trying to save the world. My colleague, the late Dr. John McDougall, was a good example. He wanted to save the world, and he believed that unless we converted everybody over to a plant-based diet, that the world was doomed because of the environmental consequences of an animal-based diet in terms of global warming and the rest of it. And so he wanted to make the diet as flexible and as easy to apply as possible so that the largest number of people possible would be willing to adopt a vegetarian diet. And if your goal is to save the world, I understand that. And I'm so grateful that there are people out there, trying valiantly to do that. But if your goal, like ours is at TrueNorth Health, a little bit different. We're not out to save the world. We're out to get our patients to live a good life and then have a good death when they go to sleep one night having reached their genetic potential, and not spend the last 20 years of their life unable to talk or move, lying in some nursing home bed because they had a heart attack or stroke secondary to preventable cause. And the way to do that is to be more diligent about controlling salt, oil, and sugar in the diet. So yes, if you give people more salt and more sugar, they'll like it better. It's easier to get more people to do it. Maybe you will have a better chance of saving the world. But if your goal is to live a full and healthy life and avoid that last decade or two of debility, then you have to tighten up the screws further and eliminate the salt, oil, and sugar and stick to an exclusively whole plant food diet and not be putting a little of this and a little of that into it.
There's been a lot of controversy about oil. A big brand, Forks Over Knives, one of the brands that I would say got so many of us started with that first documentary, has changed their dietary guidelines and said that a little bit of oil is okay for healthy people, or however they worded it. But essentially, they're putting oil in their recipes.
John McNeil is famous for saying that people love good news about their bad habits. And so if you give people a little of what they want, they're way more happy about it. And I'm sure if you're trying to maximize your brand and get as broad an audience as possible, that might be an effective strategy. But I want to ask you this. If you were treating, for example, a patient who was an alcoholic, you wouldn't say, well, you can have a little bit of wine and beer. If it's organic red wine, or you can have a little bit of organic beer, or you can just don't drink after 5 p.m. Just have your alcohol earlier in the day, or only have it on the weekends. You wouldn't say that because it doesn't work. Would alcoholics like to be told moderation would be fine, a little bit of that? Yeah, of course they'd love that. But what alcoholics find is that a little becomes a lot really easily, and it's a very slippery slope. Could somebody have a little of this and a little of that and get away with it? Probably, depending on the person and their circumstance. But what we found is in order to instill good long-term dietary compliance, the people that are successful over the long run find it much easier to get rid of the things that fool their satiety mechanisms and fool their brain than it is to kind of constantly tease themselves. Just like alcoholics find out, it's a lot easier to just not drink than to try to regulate your drinking. Most people find it's a lot easier to avoid the salt, the oil, the sugar, the processed foods than it is to try to figure out how can they regulate it enough that they don't get premature aging and debility. And so what we advocate is a whole plant food SOS-free diet. Does everybody that we work with, are they 100% compliant? No, there are people and they make various degrees of exceptions. And, some people get away with it short term. Other people, recognize they really can't get away with anything. So if you're overweight, if you're dealing with diseases, if you're having these issues, we're right. Whole plant food, SOS-free diet. If you're healthy and you want to stay that way, short term, you may be able to get away with all kinds of stuff. But long term, it has a way of catching up. So if your goal is to maintain good long-term health, follow our advice. It works well. We've seen that with 40 years of practice experience, seeing people now that we've been working with for 40 years. The most common story I get from those patients is the same thing over and over again. Everybody they know is dead. So, my mom, when she was 92, she'd outlived all 50 of her lifelong friends. And many of them used to make fun of her and her son's crazy diet that she was on and all that stuff. But she said when she was 92, she'd outlived them all. And she said it was getting harder and harder to make friends because even people 10 years younger than her were so debilitated they couldn't do what she wanted to do. They couldn't go for the hike or play the bridge or whatever it was. And she said, Alan, you have to warn your patients. If they're going to do this kind of diet, make younger friends.
So true. One of the things that's bugging me about this oil thing, though, is that it's being propped up like this superfood. What's with the superfood, the polyphenols, the vitamin E, the antioxidants?
Oh, yeah.
Like
Well, it's the same thing they do with alcohol. red wine, resveratrol. If you don't drink, you ought to start. Good for your heart. They've done this with dark chocolate. That's the answer. So of course, they're gonna do that. You have to try to pitch it to people as something that's good for them. They're more likely to eat it. Look what they've done with milk. They tried to make milk probably one of the most antagonistic food factors that people get exposed to, as if it was some kind of mandatory health food. In fact, the federal government mandated that school children get milk. If the blacks that are 90% don't, 90% of blacks don't make lactase, 80% of Asians, doesn't matter. If the schools didn't give them cow milk, they were losing their federal funding and stuff. So this is a common strategy that's used is to try to misrepresent some compromised, highly processed food as some kind of superfood. And to the degree that it's based on some kind of plant-based product, like, resveratrol comes from the skin of the grape. So there's still some vestige of nutrition left in it, even when it's been fermented and highly processed. But if you want resveratrol, eat the grapes. And if
Yeah.
you want oil, eat whole foods because they contain all the fat that you need. The diet that we advocate is not actually as low a fat diet as, say, a McDougall or Esselstyn's 10% of calories from fat, because we do include limited quantities of nuts, seeds, avocado, things of that nature in the diet for most of our patients. So it ends up being about 15 to 18% of calories from fat. And that's using very modest amounts of these whole plant foods, about 10% of calories from protein. Well, the problem is as soon as you start using oil, oh my gosh, there's more calories in the tablespoon of oil that people put on their salad as dressing than there is in the entire salad. And so even though it looks like a very small amount and people aren't perceiving the impact of it, it actually becomes a significant percentage of calories very rapidly. And so and it has very little bang for the buck. And if you use an eyedropper to introduce your oil on the salad, you might be able to reduce the quantity to the point that it's less detrimental, but you wouldn't know that it's there. So if you're using enough to know that it's there, you're already, blowing your percentages out of the water as far as we're concerned in terms of long-term health maintenance, and certainly for people that are trying to overcome health problems. McDougall talked about the fat you eat is the fat you wear. That you can do biopsies of people and actually tell what kind of fat it is that they're pouring on their food. So I think we need to be really careful about if the organization's goal is to save the world, whatever they got to do, they're being flexible, I understand. But if your personal goal is to live a long and healthy life, get rid of the salt, oil, and sugar, and you're likely to do a lot better than you are with some halfway compromised approach.
Yeah, the doctor in the great oil debate was recommending 1.5 tablespoons of oil a day of extra virgin olive oil, which in itself is like, that would be what, 9% of your daily calorie intake is from fat, just from that little bit of oil already. So I mean, you've run out. Doesn't make much sense.
Well, it doesn't make any sense in terms of your own personal health goals. But it does make a lot of sense in terms of making the diet more palatable to a wider range of people. So, again, I think you have to look carefully at what the motivation and the goal is. If the goal is to reach the most people, make it as simple as possible. Maybe they've got, maybe that's what their target is. If the goal is your own personal health, though, you have to go beyond that.
Well, and it's so just staunchly defended, the oil, we need it in the food in order to absorb the fat-soluble vitamins. Are there not other ways to add fat to a salad? We need it for the polyphenols and the antioxidants, like I was saying. But we can get these from whole foods. It's interesting that people, if we had a study about how healthy kale is, which we know it's healthy, we still wouldn't have these great kale debates and where people are fighting for this one ingredient. I think it all comes back to good news about bad habits. People want the tasty oil and they can't get rid of it.
Well, of course it is. That's exactly what's going on. And, that's why when we talk about the pleasure trap, the artificial stimulation of the dopamine that comes from these highly processed foods is very appealing. In fact, think about this. This might give people a little insight. We know how hard it is to quit alcohol if you're an alcoholic. If you go to an inpatient program, spend $40,000 for 30 days, go to 90 visits in 90 days to a 12-step program, and you have family support, the likelihood that you'll be drinking in within 12 months is 82%. And if you're a heroin addict and the court mandates you go to inpatient care, the likelihood of you using heroin within 12 months is over 90%. But if you ask somebody to lose 5% of their body weight and keep it off for a year, the failure rate is 95%. So a physician has a better chance of curing a heroin addict than he does helping a person lose weight and keep it off. Because at least with drug addicts and alcoholics, we tell them the truth. They need to stop taking the chemicals that are fooling their brain. We don't tell them to have just beer and wine. Okay. So with weight loss, we lie to them and we say, well, put your food on a smaller plate and put your fork down between each bite. You won't be fat anymore. And it's complete nonsense. What you have to do is stop taking the chemicals that fool the satiety mechanism in your brain. And those are the salt, oil, and sugar. Okay. People don't like it. It's not going to make you popular. It may not save the world. But if you get rid of the salt, oil, and sugar, go on a whole plant food diet, you can reverse your disease, lose the weight, and maintain long-term health. That's been our experience.
What is with this fixation on polyphenols, antioxidants, all these things? Do we need to pay attention to this with our food, or can we just eat the whole food?
I think we do, in the sense that this is a superfood diet, a whole plant food diet. Literally every food we're including could be considered a superfood. You know, the overall integrity of the diet gets the quantity and quality of nutrients we need without the consequences of dietary excess. But let's be clear, it's not deficiency generally, it's excess that's the major culprit here. With 75% of people overweight, the bigger problem, the biggest concern is how do we get rid of the dietary excess? And the only way I've seen to reliably for patients to do that is to get rid of these highly processed forms of concentrated calories in the form of salt, oil, and sugar.
What about these magic foods in general, and the ones that are generally labeled superfood, whether it's olive oil or goji berries or anything else? Like, how important do you think any one food is to the diet?
Well, there's absolutely no food that's essential or critical. And if you don't like something or you're allergic to something, it doesn't matter. Whole class of foods. Beans, highly nutritious foods. Some people don't digest beans well. They have sensitivities to lectins or whatever it is. They can stop eating beans, eat more of the grains, the starchy vegetables. Some people don't do well with high amounts of sugar. They don't have to, nobody has to have fruit. They can have more salads and vegetable materials. There's such an abundance of whole plant foods out there that you can get the quantity and quality of nutrients you need. In fact, what's interesting is it's literally impossible to design a diet that is a variety of whole natural foods that doesn't get the quantity and quality of nutrients you need, with one exception, and that's B12. Vitamin B12 needs to be fortified because the only source of B12 is bacteria. And without all that nice feces that people are getting from their dead, decaying flesh, the B12 concentration and intake in vegans can, over enough years, be deficient. So we do recommend that they supplement B12 because of hygiene. The problem is, if you don't use hygiene, that is, you don't wash and peel and be careful, you end up with parasites and worms and problems we don't like. If you do use hygiene, you can reduce your bacterial contamination to the point where eventually you don't get your natural source of B12. So we supplement B12. For people that refuse to go outside adequately or live too far north, we might supplement their D. But beyond that, the problems that people are suffering from are conditions of dietary excess. Getting rid of the excess is the critical issue, and eating a whole plant food diet is essentially eating a superfood diet.
I've been to your practice and I've seen that you do sell some supplements that are beyond the two that you've mentioned. Can you give us your sort of methodology on how and when supplements are necessary for a person?
There are people that have all kinds of debility. They're on medications, for example, that while we're weaning people off medications, those medications can deplete electrolytes, can cause all kinds of difficulties. People have sometimes, while they're getting used to the dietary change, have bowel-related issues that can be managed with increasing things like magnesium citrate, etc. There are times where people's digestive system has been so debilitated, often by surgery or medication use, that digestive enzymes or other aids may be useful in helping facilitate the transition to getting them healthy again. The majority of stuff that we're involved with would be vitamin D and vitamin B12 because we believe those are necessary for people. Everything else is really just a therapeutic application in an individual situation. There are people that have sleep disruption issues that you can sometimes help mitigate with melatonin or other substances. There's lots of things that you use medically that are the exception, not the rule, and you're using to deal with a specific problem with a physician, hopefully, that's not an idiot. And so, we want to be really clear, though, that overwhelmingly, nutrition is much better provided by diet than pills. But there are clinical exceptions where you're going to be using something to get an end game, but you're going to treat it much like you would pharmaceuticals in the sense you recognize it's not because there's an inherent deficiency in a whole plant food diet with the exception of B12, but rather some people's ability to absorb nutrients or have, processed foods and deal with things can be sometimes altered by their disease or their medications. It brings up an important point, though, this discussion is that, for example, today we have diseases like autoimmune diseases and cancer, leading contributing cause of death and disability. They're basically opposite sides of the same coin. In other words, with cancer, it's essentially if your immune system doesn't fight off the cancer cells as quickly as they form, you grow tumors and then you end up dying from cancer. If you treat cancer conventionally anyway, you suppress the immune response and often or enhance the immune response, stimulate the immune response, you often end up with autoimmune disease. So if the immune system is working overtime and attacks itself, we call it autoimmune disease. And if you suppress the immune system, you end up with cancer. So if you treat autoimmune disease with medication, sometimes the consequence is increased risk for cancer. So the point I'm making is you say, now how are those conditions managed? Well, typically they're managed with very powerful drugs that either stimulate or suppress the immune response, often given intravenously in infusion centers. What people don't realize is the doctors prescribing those medications are paid per unit. So the more drugs they prescribe, the higher the dosing, the more they make. And it's incredibly lucrative. Now, the medical profession tried to separate physicians from the pills they push because they realized there was an inherent vested interest and that, that wasn't a good thing. And so they came up with the pharmaceutical industry and they kind of separated the two. But now we've gone back to bribing doctors to prescribe pills, or not pills so much, but infusions through infusion centers. And now it's a hugely lucrative market. And so you're going to see great resistance in anything to do with cancer or autoimmune disease because it's a huge profit center. And so that can bias people's views. Just like if your goal is to save the world, it might bias the recommendations you make to people, and you may be very well intentioned, but that doesn't necessarily mean that because your goal is so important, somebody else's goal, i.e., live right up until the end fully functionally, isn't also a valid consideration. So that's what we need. I think we need these different voices, which is, yes, we need people out there saving the planet, but also, somebody that's trying to do the right thing and is really interested in not having to have their kids change their diapers when they're older, has the right to know that relatively simple changes like get rid of the oil, salt, and sugar can make a huge difference long term.
Absolutely. What do you think are the things that knock people off? They come from TrueNorth and they're just like gung-ho, ready to go, and then they struggle, and little by little they're like not on the diet anymore. What's knocking them off?
Well, I think it's like any addiction. The big risk for alcoholism, for example, isn't right when you're first sober. After you've been sober for a while, people start thinking, I used to be an alcoholic, but now I'm better. And I could drink normally. I could have a little bit and I'll be fine. And at first, they might even do that. But before very long, they may find themselves unable to talk or move lying naked under the Golden Gate Bridge, because what happens is a little becomes a lot really easily, and particularly for people that are vulnerable. Could somebody have a little cheese and chocolate and not get fat and sick? Maybe. But if you're overweight, it's not you. Because if you could have controlled it, you would have controlled it. It's not like you haven't tried. It's really difficult. And for some people, it's more difficult than others. For example, if you're one of those loving, caring people that cares what other people think and you don't like to upset other people, this is going to be a lot harder for you. Because, and particularly if you're successful, you will piss people off. You and your perky smile and your thin clothes are going to really annoy them. And they're going to come around. And if you were before, when you didn't eat healthy, you never said a thing. But now it's going to be, where are you going to get your protein from? It's not good to be a fanatic. You're no fun anymore. Blah, 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 blah. And so socially, I think that's a big problem, especially for loving, caring people, because they don't like being odd man out. They don't like upsetting everybody else. They don't like being controversial. They just want to go along and get along. And so it's a great challenge because we're asking people to be outside the norm. If you're not overweight now, you are abnormal. We don't want people to be normal. We want them to be healthy. Healthy people are not overweight. For every pound of fat you have about 1/10 of a pound of visceral fat. Visceral fat is hypertrophic, hypermetabolic, hyperplastic. It acts like a tumor. It's giving off inflammatory products that causes heart disease, cancer, diabetes, autoimmune diseases. Do you notice they treat those diseases as independent, unrelated conditions? They're all tied to the inflammation that's largely associated with how much visceral fat you're carrying around. So you don't want to be normal. You want to be healthy. So if you started thinking about maybe if you put some oil, salt, and sugar in your food, you could dramatically expand your business profile and reach a lot more people?
Well, I'm like you. I want to help the people, and so I'm here to make their lives easier. So I'll just take the less money. But hey, not a lot of people are doing what we're doing, so I'm not competing with too many people because they're all going the way of forks over knives, adding the oil back in, and that just leaves more people for Well Your World to scoop in and help and create that community, which I think, like you said, with social pressure is like the hardest thing, is dealing with other people not accepting you for the choices that you've made. And I just wonder, like, what do you tell people? How do you recommend a change, to beat that?
Well, I don't think you can be there. I think that is ultimately the approach. And, that's what we keep doing research and trying to investigate and make sure that we're doing it the best way we can, and our motivations are very transparent as well. We're trying to tell people, what the goal we're trying to achieve here is. The goal is that you go to sleep one day and you don't wake up and you don't spend the last 15 years debilitated.
Absolutely. Well, thank you for your time, Dr. Alan Goldhamer. We'll have you back again soon, and we appreciate your insight. One of the questions I get so often is, can you refer me to some good plant-based doctors? Well, these are them. TrueNorth offers they have a dozen doctors now that do telehealth services. They can do a 30-minute or an hour or whatever. That's from the comfort of your own home. You can get your questions answered. And what's so important is these doctors actually understand our approach to health, diet, and lifestyle. If you're looking for a quick doctor appointment or ongoing, these are them. Click the link down below. We'll see you on the next video. Thanks for watching. Bye.